Hi guys, so video 2 on the DIKW paradigm, which is data, information, knowledge, and wisdom. Data is the parts that are collected to paint the whole picture, so it's just little pieces of data that kind of all come together, and then information would be the organization and interpretation of the data that's collected. So once it becomes information and becomes a whole picture is when it gets meaning applied to it. So you're able to kind of see more of what's going on. Past that is when the subjectivity becomes applied. So with knowledge, it's internalizing and integrating the information so that we can answer why something is happening, how it happened, as opposed to just what's happening, where it's happening, why, when it's happening, kind of how data and information do. The final piece of this paradigm is wisdom, which is action on the knowledge that you've built. So it's taking the picture that you've painted and understanding what you have to do with it in a way that's meaningful and helpful to the patient. So kind of all applies to patient care in that as nurses we have to know not only how to holistically gather all the data and get all the little bits and pieces, but we have to actually know what that means for the patient, for their course of whatever brought them in, whatever disease process or injury or whatever is going on in their life. So, for example, treating a young cancer patient. For data, the data would be, well, this is a, 34-year-old with thyroid cancer, but looking at the whole picture, you want to know, family life, career, maybe they have young children, maybe they have an active lifestyle, and so knowing the diagnosis and the prescribed treatment isn't enough. As nurses, we need to know how to not only preserve the quantity of life and to keep our patients alive and healthy, but to actually ensure that they have a good quality of life by applying everything that we gather in a way that can really help. So that's kind of what I have on the subject. Thanks.